to order. Please note that all meeting participants and member of the public will need to select the language they prefer to listen to the meeting in. If you look in the bottom right hand of your screen, you'll see a button that says interpretation on the bottom right. Please click on that and you can select either English or Spanish. Even if you can hear me now, you will need to select your preferred language in order to be able to hear throughout the meeting. Next, I will turn to the roll. Board Member Broad. Thank you. Board Member Flores. Okay. Board Member Hall. I don't have a visual on Member Hall, and he may be on mute. Okay. Board Member Lightstone.
Here.
Thank you. Okay. Also present from our staff today at today's meeting are our Executive Secretary, Santiago Avila Gomez, and the Assistant to the Chair, Ed Haas, who are providing technical support. As we all know, we are living in rapidly changing times and still operating under the COVID pandemic. And we are taking all necessary steps to protect the health and safety of our staff as well as members of the public. Thus, in accordance with Executive Order N2920, today's meeting is being held via teleconference with an option for members of the public to dial in either on their computer or via phone. At the close of the business portion of the meeting, we will open the meeting up for public comment on any of the topics discussed today. Members of the public who have contacted the board either by email or phone and asked to be placed in the public comment queue will be called upon first. If you did not previously indicate that you wish to make public comment, you may still provide public comment, and we ask that you do so, indicate so in one of several ways. You can either email Santiago Avila Gomez or type raise your hand using the raise your hand feature in Zoom, or type in the chat. Please note that we will not be accepting substantive comments in the chat. We do ask that you share them with us. If you are selected for public comment, or when you do make public comment, we also ask that you provide your name and the organization if applicable. This information will become a part of the official record of today's proceedings. If you wish to speak more than once, please alert the staff and you will have your name placed back in the queue. If you have technical difficulties when you are called on, please reach out to us via the Zoom chat function or email, and we will make sure to come back to you. We do have limited capabilities for managing participation during the meeting, so we do ask that when you are not speaking, that you place yourself on mute for the benefit of all, and wait to unmute until you're called upon to speak. You can also see these instructions, which are on our agenda, which is posted on our website at alrb.ca.gov. Proceeding to the first item of the agenda, I'm asking for approval for our public meeting minutes from December 8th, 2020. May I have a motion to approve the minutes? Member Lightstone? I think I saw Member Lightstone. Second, thank you. All members in favor say aye.
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 Great. Thank you so much. Okay, moving on to the next item is our chair's report. First, I am so very pleased to welcome two new members to our staff. Lori Miller and Angelique Duran are our ALRB's two new legal secretaries, and they are on their second week on the job. We are so thrilled to have them join our team and help us in their important work. Please give a warm welcome to Lori and Angelique. I should also note we do still have one vacancy, the AGPA, and that is posted online. We're hoping to fill that in the coming weeks. I also want to highlight a new addition to the ALRB webpage, our newsroom page. This is an option you can find on our homepage on the left under featured links or under the About Us section. Here we are providing information in the form of press releases. You can find information about where to make a Public Records Act request, as well as connect with our outreach team for ways we could partner. And we're also featuring members of the ALRB team in the news as they go out into the community and provide education and outreach. So please do check it out for the latest news from the ALRB. Lastly, before we turn to our Vaccinate All 58 campaign guests, I do want to take a moment to acknowledge Black History Month, given that we are in February. I want to take this moment to acknowledge and reflect on the importance of this month and what this means about reflecting upon, learning on, and better understanding the history of the Black experience in American culture. It's important that we take this time to not only honor that history, but also make sure that we're sharing that history that so oftentimes has maybe been misrepresented or all too often erased for other purposes. One aspect of this that I have been focused on in these past few weeks is the reason for our act, mainly because of the exclusion of two key industries from the National Labor Relations Act, both agriculture as well as domestic service. And the reason for that being that these industries at that time nationally were dominated by African Americans and they were excluded. Too often, societies that perpetuate systems of systemic racism have often tied that to economic injustice and the exploitation of labor. Because of that history, we now have our Agricultural Labor Relations Act here, and we were able to provide those protections, granted for a workforce that is comprised of primarily different groups of individuals who unfortunately have also been exploited. Latinos, Filipinos, Chinese, and Japanese Americans who provide the work in our fields. As we reflect upon this, I was looking at some context between Cesar Chavez and Dr. King, two critical civil rights leaders who led these key movements at the same time, who I don't believe ever met, but did publicly admire each other and each other's work. And I found a telegram that Dr. King sent to Chavez in 1966 stating, "Our separate struggles are really one, a struggle for freedom, for dignity, and for humanity. You and your fellow workers have demonstrated your commitment to righting grievous wrongs forced upon exploited people. We are together with you in spirit and in determination that our dreams for a better tomorrow will be realized." As I reflect on these words, I think about how we can learn from these words today. As we all know, the conversation about racial injustice has been an ongoing conversation. And while in the past year, that conversation has heavily focused on police brutality and civil injustice, there is still a tie-in with our work in terms of promoting labor rights for all, making sure that the protections of our act are fully realized for all of those who it is intended for. So I just want to take a moment to acknowledge that. And then I also have the pleasure of turning over the floor to Board Member Hall, who would like to share a few words with us. Member Hall.
Thank you, Madam Chair, and thank you to the board and to all those participating in this meeting today. We're excited. As you know, Black history as an African American, and just as an American, we're excited that we have a chance to celebrate all nationalities and cultures in our country. As you know, Black History Month is an annual celebration of achievements by African Americans and a time for recognizing their central role in the United States of America. Also known as African American History Month, it grew out of Negro History Month, the brainchild of a noted historian, Carter G. Woodson, and other prominent African Americans. And since 1976, every US president has officially designated the month of February as Black History Month. Other countries around the world, including Canada and the United Kingdom, also devote a month of celebrating Black History Month. The story of Black History Month began in 1915, half a century after the 13th Amendment abolished slavery in the United States. That September, the Harvard-trained historian Carter G. Woodson and the prominent minister Moreland founded the Association of Study of Negro Life and History, an organization dedicated to researching and promoting achievements by African Americans and other people of African descent. Known today as the Association for the Study of African American Life and History, the group sponsored a National Negro History Week. It was only a week in 1926, choosing the second week of February to coincide with the birthdays of Abraham Lincoln and Frederick Douglass. The event inspired schools and communities nationwide to organize celebrations, establish history clubs, host performances and lectures, concerts, dinners, and wore their dashikis like the one I'm wearing today, and I should have mailed one to each of you. In the decades that followed, mayors and cities across the United States of America began issuing yearly proclamations recognizing Negro History Week. By the late 1960s, thanks in part to the Civil Rights Movement and a growing awareness of the Black identity, Negro History Week had evolved into what we call Black History Month on many campuses. President George Ford officially recognized Black History Month in 1976, calling upon the public to seize the opportunity to honor the too often neglected accomplishments of Black Americans in every area of endeavor throughout the United States of America. And since 1976, every American president has designated February as Black History Month and endorsed a specific theme every year. This year, the theme for Black History Month is Black families, the Black family representation, identity, and diversity, explores the African diaspora and the spread of Black families across the United States. And it's so interesting that even still today, Black and brown families across this country must still fight for justice, must still fight for liberty, must still fight for equality. Racism and police brutality is still on the roll. And as an African American, I'm proud of the accomplishments and the contributions of every African American here in the United States. And even more, I'm proud that we as African Americans have a history of standing up and with and fighting for other nationalities, even when we see that they have been wronged, taken advantage of, or when their civil rights are violated and challenged. My friends, we must continue to celebrate diversity. We must continue to embrace inclusion, and let us continue to love one another, regardless of color of our skin, where you were born, what religion you practice, and who you decide to love. And these are the principles of African Americans across the United States of America. Happy Black History Month. Thank you.
Thank you so much, Member Hall. Very much appreciate your words. And I still learned something through that, giving the context and the history for why we have Black History Month, and it's so important. So thank you for sharing that.
Absolutely.
All right. Next, I am pleased to introduce two members of our Vaccinate All 58 campaign, the state of California's campaign to ensure all Californians are able to get vaccinated. I have Senior Advisor Sonia Harris and Tomas Evangelista, who I believe is the External Affairs Coordinator for the Vaccinate All 58 campaign. Tomas, I hope I got your title correct. And they will be focusing on vaccine distribution, specifically with respect to the farm worker population, which, as we all know, is our focus. So without further ado, Sonia and Tomas, please share your presentation with us.
Thank you so much, Chair and board members. Very much appreciate this opportunity to be with you today to share more about our work. We did have a visual presentation. There we go. I think it's coming up. Here we go. And just before we begin, also just really want to thank Chair Hasid for her leadership, not only inviting us here today, but also just being a part of, a variety of conversations, helping us to inform our work as our campaign continues to pick up steam. We'll walk through kind of several different components, some on the operational side, but then most importantly, how we'll be reaching, a variety of different communities, including the farm worker community through our campaign, and how we might be able to partner together. Again, Sonia Harris, I come to this work most recently serving as the Chief of Staff for the California Complete Count Census 2020 campaign, which feels like it was many years ago in just my 4 short weeks on the Vaccinate campaign team. There we had $187 million to deploy over a 3-year period. And so, looking at the incredible challenge that we have responding to this crisis and pandemic, very much look forward to working with the entire CDPH family, as well as you all. Really quick, Tomas, want to give you the space to say hello and introduce yourself before we jump into the agenda?
Yes, of course. I want to thank for the invitation to present here with Sonia. This is day 3 for me. Like mentioned, my name is Tomas Evangelista, and I'll be working with the Vaccinate All 58 campaign. I was a promotor for 5 years and recently worked on the 2020 census outreach for California, specifically in Region 4 in the Central Valley and the rural counties, and also doing work in Fresno County for Region 6 and Placer County for Region 1. So I'm excited to get to know the diverse agricultural sectors and also engage with our diverse farm work community.
Thank you so much, Tomas. May we move to the next slide, please? So as I mentioned, we've got a lot to cover, and so we'll try to move quickly through some of this to allow for some time for questions at the end, and obviously would love input from the board members and others. So we'll just go ahead and start with some framing, just a little bit around kind of what we're seeing in terms of cases, some of the basics around the vaccine, and then move into really the bulk of the conversation around how we'll really be reaching the farm worker community, and then kind of move into how we can partner. Next slide, please. So just kind of wanted to give a quick snapshot of kind of where we are today. A large portion of the CDPH family outside of our team is still focused very much so on continuing to address the real-time impacts of the pandemic on various communities. And so just wanted to give you, a sense of the total cases, unfortunately, the total deaths that we've seen thus far, and then really continuing to focus on the number of tests that we're putting out, to make sure to kind of track and inform, the movement of the virus through kind of communities. So just a quick snapshot, total cases as of our data 2 days ago was just over 3 million. Next slide. Oh, there we go. Also wanted to really say thank you. As we started to see the beginning of kind of the most recent and most deadly surge, really the act of individual Californians helped us bend the curve. So as you can see, when various stay-at-home orders were implemented throughout the state, really the actions of Californians to step up did make a difference. And so, when we look at hospitalization in the first sort of set of data here displayed, and then sort of the second relative to ICU capacity and patients, we really see, a really good sign that the surge, is coming down. But, again, as Dr. Galley and Dr. Aragon, our leadership has continued to impress upon Californians. It is not a time to put our guard down. We do need to continue to be responsible as we look to, the light at the end of the tunnel with which we hope the vaccine will deliver. Next slide, please. Just to give a little bit of background on the vaccines, we are still in a place where there are lots of questions about how they were developed, what they are, what the differences are, and such. And so wanted to bring forward just a little bit more information on the 2 vaccines that are approved for use. I'm sure you've heard about these in the news perhaps, or heard friends or family talking about them who might have already gotten their vaccine, but the first being Pfizer BioNTech, and really for those 16 and older, and note that the time between your first and second dose for that particular vaccine is 21 days. And then the second vaccine being Moderna for the 18 and older, for those that are 18 and older, and then a little bit of a difference, a 4-week window between the time you receive your first and second dose. And then, of course, with both vaccines, very excited and eager that they are up to 95% effective. Those are really great numbers, and in terms of how well they will perform as a way to keep our community safe. Next slide, please. One of the things that we are very focused on ensuring is the ensuring that Californians receive the appropriate outreach and some confidence that the vaccines are safe. There's a lot of questions around the name of the program being Operation Warp Speed in and of itself creating fear. But aside from that, just, really what are some of the long-term impacts, really kind of a wait and see moment to understand how, folks are reacting to the vaccine. And so, we really want to, I think, bring forward here the intentionality of California. We very early on assembled a scientific safety review work group, one that other states on the West Coast joined, and really with the intention to have an independent body take a look at the science and data behind the vaccine trials and make sure that before California moved forward that they were indeed safe. And so this body comprised of medical professionals, both here and in those Western states, have reviewed that data and have concurred that they have met the high standards for safety and efficacy that all of us would expect and hope to have as we consider taking this vaccine. Just like any other vaccine that you might take, or similar sort of delivery, there are some side effects that folks can expect, a sore arm, aches and fevers and such. There are some whose body may not experience some of those side effects, but that doesn't necessarily mean that it's not working. It just means the way that your body is reacting is a little bit different. And so, again, really want to impress upon folks that it's safe and there would be some minor side effects potentially as, they have the opportunity to take the vaccine. Next slide. So kind of getting through whether or not it's safe and California's concurrence, on the actual product itself that will reach Californians, which, mind you, is still in very, very limited supply. California's really took on a set of guiding principles to ensure that we had a very specific North Star to work towards. And our North Star continues to be equity in looking at how we can get this vaccine to Californians in the best, most timely, but also most equitable way possible. So, from the start, in addition to that scientific safety work group, we also stood up a body called the Community Vaccine Advisory Committee, really to provide input to our drafting guidelines work group, who has sort of been leading the charge on how we can prioritize different communities, with the vaccine scarcity that we've seen and really taking stock in the first few weeks of vaccine distribution. We did really evolve our thinking and are shifting to an age-based system that will take into account the high risk of morbidity and mortality that we see and are seeing among communities. But again, I think it's very important to continue to highlight how equity through all of this will be and continue to be our North Star. Next slide, please. As we look at transitioning to that age-based system, we do still have what was originally called the Phase 1B Tier 1 communities intact, which does include farm worker communities. And so, there are several counties throughout the state that have already begun vaccinating to this community. I just wanted to put up a few different examples that we've become aware of, local programs that are either testing pilots to really understand how the farm worker community is reacting to them, or looking at ways that best meet people where they are. We recognize there are different needs for different communities, and that really looking at not just the components of how we'll reach them to talk to them about that access, but really how we will get the vaccine to them are important. So in Fresno County, there are a few different types of pilot programs that are moving, some with on-site vaccinations. There's one particular employer who did have that type of model, and we were very eager and excited to see that they reported to us that 88% of their farm workers did indeed accept the vaccination. So it's a really good take-up rate, and obviously want to understand some of the elements that played in there. Also in Riverside County, we've seen some on-farm clinic partnerships between the county and growers with staff that are equipped in language to address questions and help folks through that process. And then last but not least, in Santa Cruz County, we're also seeing some really wonderful partnerships between the Strawberry Commission, the Farm Bureau, and others, really, again, working together to see these communities come together to look at ways to best deliver and prioritize their farm worker communities. Next slide. Moving on from kind of some of the how to really the nuts and bolts of our campaign. Thinking about some of the components and lessons learned from the census, we had a very robust air game coupled with an incredibly important ground game. And so, I'll kind of walk through the infrastructure that we're building to support a similar type of work, which is also modeled after, other successful campaigns that have run statewide. So our goal as the Vaccinate All 58 team is really to continue to focus on an equity-driven approach with the goal to educate, motivate, and activate Californians to get their vaccine when it is their turn. We have a particular focus on those communities that are disproportionately impacted throughout the state. And really want to drive key messages around the basics of the vaccine. We know different folks have different access to information, and really want to make sure that some of the understanding of the safety of the vaccine, the fact that it's free, and that your information is protected all the way through this process is very important to us. In addition, really looking at addressing barriers like the lack of access and hesitancy. And then last but not least, making sure that Californians really understand how to navigate their eligibility and the process. Again, as vaccines are very scarce, we continue to work very closely with our partners in the press space and through earned media to make sure that we're providing them updates as frequently as possible to help us in that message as well. Next slide, please. So how will we deploy our goals to our audiences with those key messages? And it's really through 3 core strategies. The first strategy is really one that is near and dear to my heart. Again, at the census team, we had a very robust way of really intentionally investing in specific communities, those that are the hardest to count, the hardest to reach, and really taking lessons from that here as well. And so we will be informing all components of the campaign through a data-driven approach that is intended to evolve over time as the campaign will need to in the coming months. The second strategy that we'll really be deploying is around that air game that we talked about, focusing on communications that are rooted in cultural humility. And last but not least, that ground game, really leveraging those networks that we know are the places that are so important to a variety of communities, but especially our farm worker community through trusted messengers. Next slide. So what does cultural humility in communications look like? For us, that means sort of a variety of different things. Really being community informed, working hand in hand to understand how communities take in information, but also what are the types of messages we need to put forward. We know that language access is incredibly important, especially to our farm worker community, whether that be serving up messages in Spanish and indigenous languages, perhaps primarily verbal versus written, Hmong, Punjabi, Tagalog, Chinese, Japanese. We will deploy a very robust campaign as it relates to the languages that we will be serving. Addressing vaccine hesitancy, already talked a little bit about that. Very important for us is also combating mis and disinformation. We know that fear and the amount of fear that has been instilled in so many communities, especially over the last few years, is something that we can't ignore. And so really making sure that we have a robust system to monitor not only what's going on in social space, the Facebook, Twitter, all of those different platforms that exist of the world, but also, really trying to capture what might be happening on the ground as well. The messages that happen in communities and corner markets and such, and really trying to make sure that we have a full view of mis and disinformation that may be propagating in different areas. Of course, trusted messengers, we talked about that. We'll also continue to really lean on our partners in ethnic media, particularly building partnerships with folks like Radio Bilingue. We've already had a chance to engage in a very meaningful way with ethnic media relative to doing some briefings with them in partnership with leadership at TODEC, as well as with Dr. Aragon, our new director at CDPH. And last but not least, fully integrating with our community outreach program. And I'll talk a little bit about what that looks like. Next slide, please. So that third strategy is really focused on leveraging trusted messengers. And so we are working very closely with our brothers and sisters at the Department of Social Services, as well as Labor and Workforce Agency. They have two sort of specific cohorts of CBOs that will be an extension of our campaign, while they are also serving up some other messages relative to harm reduction and workers' rights, and really making sure that we're connecting these communities with safety net services that have existed or been built over the time that we've seen COVID. Those are very important, but also really leading with vaccine messaging. So last week, we were excited to announce a large portion of the 30 million that's listed here for that outreach project with just over 100 community-based organizations in our first cohort. And happy to share that with you all, and look forward to announcing our second cohort later in February. We're managing this work in partnership with two community-based organizations that have also had a long history in this type of work, the Center at Sierra Health Foundation, as well as California Community Foundation. And we sort of think of this as our core group of CBOs, but they certainly will not be the only folks that we tap to help us leverage, again, those trusted networks. We'll also be working very closely with philanthropy, who will be funding a variety of other community-based organizations, other state agencies like you all, and of course other partnerships, as we look to really have a robust education and outreach campaign. Next slide. So linking that first strategy around data with what our trusted messengers and our campaign will do, just a quick snapshot of the Healthy Places Index. This is one of the inputs to kind of our data strategy that we're focused on, in addition to COVID positivity rates, to see where those disproportionately impacted communities are. We'll be leveraging these trusted messengers statewide and really prioritizing interactive engagement. So, training and making sure they're equipped with the most recent best messages that we know work with the farm worker community, phone banking, door-to-door, engagement, of course, all with COVID safety in mind, masks and such, canvassing, and also looking at other programs and ways to reach a variety of communities. And then, of course, one-way social media and traditional media that we know also often has a chance to reach our audiences. Next slide, please. As we look to each of those teams and really what their focuses are on, the Department of Social Services and sort of their COVID-19 safety project, just with the disproportionately impacted communities, is really sort of focused on a set of communities that we know, have seen sort of the worst of the COVID pandemic. And so those are listed here, a variety that we also had a chance to focus on in our census work. And then relative to the work Labor and Workforce is executing, it's really more around high-risk industries and workers in those industries, which do include farm workers and others in agricultural and food processing. Next slide, please. Oh. Can we move to the, perfect, thank you. Really, to inform our work, in addition to that data layering, is also qualitative and quantitative research that CDPH, Department of Public Health, is taking on ourselves. We did have a chance to engage with some of the wonderful knowledge and guidance of our Community Vaccine Advisory Committee, and really just wanted to share some of the top line findings and as well as barriers, and we'll talk about that in just a second, that those stakeholder interviews really brought forward. And some of this are things that we've covered, but just want to make sure that there's some confidence that these are the types of insights that we're really looking for and eager and hungry to have as it relates to being community informed. So, highlighting the safety of the vaccine and talking about side effects, and then really also what are the types of messengers and influencers that really work. So, knowing that, hearing from doctors and medical professionals really build some of that confidence. Engaging with our faith-based organizations will be another pillar of our campaign as we move forward, knowing how important they are to a variety of communities. As Tomas had mentioned, his work as a promotor here, really looking to leverage existing systems that folks are very comfortable with, and again empowering them with the information to help us, and so many others. Next slide, please. Also in those interviews, as I mentioned, we really brought forward some barriers, right? Some things that are very, very real and in terms of concerns that Californians have, and especially our immigrant communities, whether that be the fear of deportation, just continued distrust in government, and really feeling like, as it's said here so well, guinea pigs, right? Thinking about the speed and rate of the vaccine development and really, again, questioning that safety. And so those are all things that we'll look to lean into and really try to address either through our air game or our ground game as the campaign continues to evolve. And last but not least, next slide, please. We wanted to leave you with a couple different things. So the first is we did have a chance to launch our Vaccinate All 58 campaign in December. And All 58 really is rooted in a desire to make sure that our campaign also supports local communities and builds assets for local communities to adopt, take, adapt, innovate, all of those good words and things that we know come from, the being rooted and understanding what your community really needs. And so we've got a toolkit online here, and there are some assets, public service announcements in both English and in Spanish. We've got fact sheets in 19 different languages, variety of different pieces that you could take right now. And as we continue to develop the campaign and move forward, our primary communications contractor, Duncan Shannon, just recently came on board. We will continue to fill this space and probably others with more content and assets for folks to take and use to really help us get the word out. We really won't be able to do it without you all as well. As we continue, the Community Vaccine Advisory Committee, continues to inform our work. And so they have been taking so much public comment. Thank you. I'm sure many of you have already shared your thoughts, concerns, advice, ideas with the body that is led by our Surgeon General, Dr. Nadine Burke-Harris, as well as our Chief of Epidemiology, Dr. Erica Pan at CDPH. And so, would continue to invite you to provide thoughts there so that, one, we can make those thoughts public and transparent in our process and our commitment, but then obviously also to inform our work. And then last but not least, Tomas and I can both be reached at the email that was displayed, externalaffairs@cdph.ca.gov, so that if you have questions or needs that we can get those addressed and get them to the right team members, whether it be kind of on the operations side of the house, which our Secretary Yolanda Richardson has taken a recent more prominent role in helping us work through some of the pieces there, or on the campaign side with doing some of that public outreach. So with that, I will conclude our presentation and happy to take any questions, Chair.
Thank you, Sonia, so much. And thank you so much to you and Tomas for all of your important work. It cannot be overstated how critically important this is at this time, and for your focus, particularly on farm workers who we know have been disproportionately impacted. I have a couple of questions, but I'd like to just open it up to my colleagues at the board to see if they have any questions or comments for the Vaccinate All 58 campaign. Ralph, I'll look at Ralph first, yeah.
Hi, thank you. I think it was a really excellent presentation, so thank you for coming this morning. The only thing I just want to throw out is because of my age, that might be helpful in reaching people that are skeptical, is the polio Salk vaccine campaign around 1952, 53. I have two friends my age who just missed the vaccination, got polio, and are still and have lived the rest of their lives in braces and wheelchairs. And I think if you could find some people to talk about that experience, I think it might be persuasive. Just the thought I wanted to throw out. There are some people around who can talk about how not getting the vaccine, just missing it, affected their lives. So just a thought.
Thank you, sir.
Member Flores?
Hi, good morning. Thank you so much for the presentation. Very informative. I had a question. I know farm workers are in the 1B category as in terms of priority. To the extent or to what extent will the vaccine be made available to those who live in farm worker households who may not themselves be farm workers? Because, you know, from our understanding, farm workers live in multi-family homes, and we want to, well, my question is directly, you know, will those folks that live in farm worker households also have access to the vaccine in an expedited fashion?
Thank you, board member. This is something that our team continues to work through in terms of more specific guidance to give. And just to draw a correlation, this is also something we're hearing from the disability community, just in terms of you know, kind of that concern as well, in terms of being sort of co-located with high-risk communities. And so more to come. Happy to follow up on that question through the chair and staff.
Board member Broad, I thought I saw your hand as well.
Yeah, I just have a very basic question, which is how many farm workers have been vaccinated and how many are left to vaccinate?
That's a very good question, board member. And this is one of the areas we've really taken a concerted effort in over the past few weeks. Really, one of the things in our as I mentioned, lessons learned through the first few weeks of vaccination is our data is a little disparate. And so this is a place that we have primarily through the leadership of Secretary Richardson, you know, dug in with our local health jurisdictions and looked at what are some of the options to have a better picture of the landscape and really also understand how we'll be able to measure progress over, you know, the period of vaccination. You know, even the question of how many farm workers are truly in California was a significant conversation at the Community Vaccine Advisory Committee. You know, the first set of numbers that came forward really they looked a little off. And so the team, you know, spent more time, you know, sort of diving into what is truly representative of our farm worker community, also acknowledging that they do move around a little. So I think, you know, several other complexities that we'll be focused on in terms of really collecting quality data to measure success. So I think more to come on that front as we look to onboard our third-party administrator to really help us continue to manage this and streamline processes for vaccine administration.
Thank you. And then Member Hall, I thought I saw your hand as well.
Yes, thank you again for the presentation. I wanted to just circle back on the fear issue and see how you are actually dealing with that, dig deeper, drill down a little bit more with that. I know for sure in the African American community, the fear factor is alive and well. And we're seeing it more and more as folks are getting vaccinated. The African American numbers are still underperforming, and it's a problem. And now we're on the break of multiple new variants And they're saying as these new numbers are declining, the new variants that are breaking ground are going to create an incline in those who are infected. And so how are we dealing with the fear issue? If we can just drill down a little bit more on that for me.
Of course, thank you, board member. I think the answer there is really in a few different ways. One, I think, is how does the campaign get smart and really understand, to your point, the root of some of those issues? We know some of them are very historic. We know some of them are rooted.
Tuskegee Airmen, all that.
Absolutely,
yes.
Absolutely, very, very historic. And that is generations of fear that has been built over time. And I talked to a friend recently, who said, I heard from my auntie, don't do it no matter what. And so, you always listen to your auntie. It's very, very similar in Korean culture. And so, I think that's one piece. The other piece is really asking leaders in these trusted communities to step up and help us share those messages, because we can talk in the face until we're blue, but unless folks see themselves and who is delivering that message, oftentimes the message falls short. So I think those are kind of two primary components that we're very focused on. And then really also getting in and digging deep with real folks. So, one thing is, as I mentioned, the research, qualitative and quantitative that we're doing, that is intended to meet those that may not usually come encountered with government, or with services, et cetera, and sit down with them and say, why are you fearful and how can we help you? And, not necessarily in a way that tells them that they need to get the vaccine, but just serves up information to them to help them feel more informed and comfortable. And we've also had a chance to be exposed again through Alana Trout on Secretary Richardson's team to some really wonderful work that's being funded by NIH through Dr. Keith Norris and Dr. Arlene Brown out of UCLA, who have been on the ground already gathering insights from various communities, again, around hesitancy and really leveraging their learnings as well. So, I think as we continue to move forward, there will be so much more input that we'll need, especially as more fears are driven by that mis and disinformation. But hopefully that gives you some sense of kind of how we're thinking about the work.
Are you finding, Madam Chair, if I may, one more, are you finding in the African-American community or the Latino community or Korean community, what community are you finding the lowest numbers of those willing or desirous of being vaccinated?
Our direct formative research is coming back and being finalized. So we don't have those specific numbers. I've sort of only gotten top line trends, but we're happy to share that with you. I would say that the Black and Latino communities do sort of come forward as some with the most questions and fear and hesitancy, as we've seen through some other publicly available polling, Kaiser, for example, Associated Press. There are a few others that are escaping me, but we can also furnish you with some of those sort of top level findings if that's helpful.
Thank you, Madam Chair. Thank you.
Of course.
Thank you. I had a couple of questions, Sonia. One, there's been a lot of discussion about the tiers and prioritization, and can you just provide some clarification specific to farm worker distribution? I just think it's important to reiterate where they fall in priority.
Absolutely. Thank you, Chair. So just to recall, because I know there's been a lot of different conversations, around this, we really started with our frontline workers, and those are most vulnerable. So commonly referred to as our phase 1A population. So healthcare workers, long-term care. The second sort of group of folks that we're really focused on, I think as Board Member Flores had mentioned, is that phase 1B group, which is those that are 65 and older, as well as those in agricultural and food processing, childcare and education, and last but not least, emergency services. And so as we look to transform into an age-based model, we will continue to focus on those groups first before we do make that transition to the age-based model that we have recently sort of begun to socialize as sort of the next steps. And really the intention there is to simplify and standardize, right? We need a process that all Californians can understand and navigate, and really making sure that we do not sacrifice equity at the sake of speed, but really that simplicity will help us both communicate better, but then also administer the vaccine more efficiently.
Great. And then I know the governor gave, I thought was a really great analogy about kind of like the boarding of the plane, how you call up the order of who boards, and it's not that you have to wait completely for the first category to board, but you kind of get a mass and then you bring on the next group. And I think farm workers for the past few weeks have been, the 1Bs have been focused on. Can you provide just some background? I know there were some questions of maybe from certain local governments about whether they could provide vaccine to farm workers. And I think there was some guidance that went out last week. If you could provide any other detail, that would be great.
Yeah, and I think, Chair, it's really important to make sure that quantity and supply of the vaccine does not get lost. In sort of this conversation and context just a couple weeks ago, I can share, we were at roughly 400,000 to 500,000 vaccines per week that were being distributed statewide. So when we think about less than 500,000 vaccines, reaching all of the 61 local health jurisdictions throughout the state, and then further being clarified, refined through the providers that are associated with those 61 health jurisdictions, our 58 counties plus 3 cities, Pasadena, Berkeley, Long Beach. It starts to become very small pools that are in each community. And so to the extent our local health jurisdictions have really had to manage that process and really do what was sort of at the advice of their local health officers and jurisdictions. I think that has significantly played into availability across whether or not they were in phase 1A or phase 1B, or even the age-based component moving from 75 years and older to 65 years and older, and sort of taking it at their own rate. And yes, additional guidance was provided last week, and again, we'll have more forthcoming as our third-party administrator comes online, which again will be critical for us to simplify and standardize all these processes.
And I promise I just have 2 more questions. One, can you talk about how the campaign is addressing issues with both digital access as well as transportation access? I know one thing we've read about anecdotally is just you have to go online to sign up. And what if you don't have an email account? What if you don't have your own car? Those are issues that may be disproportionately higher or present more challenges within farm worker communities. And if you could just discuss how the campaign is addressing those challenges, that would be great.
Yeah, and I do want to make the distinction and sort of importance of drawing the 2 components, right? The operational how, because I do think some of what you're talking about does fall into that space, and then sort of the education component. So access and really the digital divide and sort of how real that is, whether that means you do or don't have a device, you have enough proficiency with that device to use it in the way you need to, or if you just simply don't have access to broadband, given you're in rural areas, while we are standing up the My Turn online tool, which we are feverishly onboarding a variety of different folks to the back end of that new system, which is really intended to be end to end, again, going to data quality and management, so we can see how things are being ordered, how clinics are performing, and how Californians across the state have access to. To your point, high on our list as it relates to access and equity, it is really making sure that we're providing more than just that online tool. So in addition to that tool, which we hope to have in a much sort of more robust space as we're moving out of the pilot sort of status of that, is also what we're doing to complement that with a call center. So if you can't get online, you can call our COVID hotline, which I can share that phone number with you as well. And that
great.
will allow folks to call in to schedule their appointment. Again, as more appointments come online in terms of clinics and such, and there obviously will be more access and also tied to supply. But that particular call center will also provide access in 240 languages. And so that's also something that we're very eager and excited about, and looking for more options to, again, make sure that access stays at top of mind. To your point, if you don't have an email or you don't have a cell phone, what else can we do? Which is also, the part that our CBOs will have a strong role to play. Second, relative to transportation, those are all conversations that we're continuing to have with our third-party administrator, whether it's folks that, physically do not have a means of transportation. Also looking at site selection. So sometimes, when we look at where a site might be, a mass vax clinic, for example, mass vaccination clinic, it may be so prohibitive, even in terms of the public transportation services, by means of opportunity cost and time. And so also thinking about, where the placements of clinics, making sure that they get to those disproportionately impacted communities. We're also looking at mobile clinics, on-site work clinics. Again, the pilot projects that I mentioned really are aimed at, I think, reducing some of those barriers that we know will confront, especially the farm worker community.
Awesome, thank you. And then my last question before opening up, there may be some other members of the staff or public that have questions for either of you. Love to lift up the success stories that are already out there. So I know TODEC has been working in Riverside County to help get farm workers vaccinated. Really admiring of the Fresno pilot, where there was an 88% vaccination acceptance rate. So if you have any other highlights with respect to the farm worker distribution, we'd love to hear them. And then also any lessons learned from some of those success stories, particularly the high acceptance rate. I think that's phenomenal, and we'd love to have that replicated statewide.
Yeah, thank you so much, Chair. We're actually having some ongoing discussions with Secretary Ross over at the Department of Food and Agriculture on just the amazing stories that are pouring into her as well. Of course, alongside those that have identified challenges that we'll need to address. So, look forward to more details. I was hoping I would have those yesterday, but unfortunately the way that some of the pieces slid around, that'll be for later this week. So perhaps that's also a place we can invite you, or perhaps some other members of your team to join to give those fine details and specifics.
Great, thank you. Any questions from some of our other board staff or members of the public? And Santiago, I'll be relying on you to call up those members who may have questions.
And there's one question by chat, and I'll go ahead and just repeat it here. How are you reaching H2A workers given their separation, isolation from the community?
Of course, I think, again, this goes back to our trusted messengers, our strategy, in addition to ensuring that we have a variety of different modes of communication, whether that be radio, whether that be through reaching family members. That was one thing that we really saw as a key lesson learned in the census. Sometimes it's almost thinking about the household or the individual that you're trying to reach, and what are some of the ancillary relationships around them that can help us get to them. So very much appreciate that specific call out.
Great. Any other questions for our guests? Oh, General Counsel Montgomery.
Hi, thank you so much, Sonia, for the fantastic presentation. This is very informative, and I'm really happy to hear about all the efforts that you're undertaking. I really like to, I think it's on the right track with engaging the trusted community members. I know in the farm worker community, especially Indigenous farm worker community, that is key. And as we've seen in our work and outreach, it's really the only way to gain access sometimes is through those community leaders and those people on the ground that are part of those communities. So kudos for those efforts, and also for engaging employers. I think engaging employers in going out to people's work sites, making vaccines more accessible to folks and not requiring them to call and register online, as we've seen that really can reduce the access, and it gives priority to people who have more means and resources. And so actually my question really comment about H2A, again, about H2A workers, or I just want to build on the prior question. And ask if there is an active campaign to engage the H2A employers and get to those workers through those means, because H2A workers, of course, they're on a work visa, right? And so by definition, they're not integrated often into other community groups and networks where you would normally reach them. And often these workers are housed outside of town in more remote areas. They don't have access to transportation to be able to get places easily, or a lot of them, is in my experience, are very isolated, and whether or not they have the means to get where they need to go to get vaccinated, I think is very speculative. So yeah, I just ask if there are going to be efforts to specifically engage those employers, and I think that is, and go to the housing, I would think as well, would be would increase access also, because they are required to be housed by their employers. And so if there are specific efforts underway to go to them rather than having them figure out a way to get to a clinic or something, which is going to really be a barrier for this group.
Yeah, thank you so much for that, Council. Really want to make sure that there's a fine point on the work that is being done with these pilot projects is really locally driven. So I don't want anyone to walk away feeling like these were all the wonderful things that the state did on its own. And so to your point, I think the local health jurisdictions will also continue to be a very important partner in the work that we do in this space. Again, knowing where those communities might exist, and certainly very much appreciate your sort of extra emphasis on the particular barriers around the H2A community. Other things that we continue to work on, just as you sort of mentioned, the visa element sort of more explicitly, is just, what sorts of identification, are being taken at vaccination sites, or, going on site to verify, whether or not you are a farm worker, and just making sure that we're not inadvertently creating barriers through some of those administrative processes. And so, so much to do as we look to really make sure that getting vaccines out to Californians, is executed well. And I think with the standard that we all hope would be applied relative to equity and access.
Thank you.
Of course.
Any other questions? Okay, with that, I would, I know Sonia and Tomas, your time is so valuable, and I just want to thank you again for your wonderful presentation, for being so generous with your time to inform our board today of all your important work, especially with respect to farm workers, and then for all the work that you're doing to help Californians get vaccinated. It's so critically important, and I just wish you all the best of luck. And also offer that if you would, if you are seeking partnerships, we do have an active presence in the farm worker community. We're one of the few state agencies with offices in these communities and staff that are incredibly knowledgeable, and I think could be a really great ally as we work to ensure that this population is properly vaccinated. So please don't hesitate to reach out to us. And thank you so much for your time.
Thank you, Chair. We really appreciate the opportunity to use this space and venue to share a little bit more about our work, and I'm sure we'll have more updates, and Tomas will be well equipped on day 6, maybe even, to take some of those. And so just look forward to the partnership, and thanks again.
Thank you. Take care. Best of luck.
Bye-bye.
Bye. Okay, thank you. I will move on to our next agenda item, which is the Executive Officer's Report on Elections, Unfair Labor Practice Complaints, and Hearings. Mr. Santiago Avila Gomez.
Thank you, Chair and board members. Since our last public meeting on December 8th. We've had no election activity. There have been no notices of intent to take access or notices of intent to organize or petitions for certification or decertification filed. There's been one complaint issued involving cannabis in Riverside County at San Jack Management. There have been 2 post-complaint settlements involving informal bilateral settlement agreements. One matter Satellite Farms, the other Terra Linda Dairy. There have been no in-person or virtual hearings held. We have had a series of pre-hearing conferences, case management conferences, and of course, settlement conferences that have occurred. No administrative law judge decisions have issued. There's been 1 board decision in Ocean Mist Farms involving spinach in Riverside County, 2 administrative orders relating to Gerwin Farming, and both administrative orders dealt with a request to amend the bargaining make-whole period for the board's decision in 44 ALRB number 1. Finally, there's 1 case pending before the board, and it is relating to the board's decisions. The last administrative order, which is ALRB admin order number 2021-02. Today is the last day for a motion for reconsideration to be filed. That concludes my report. I'm happy to answer any questions. The report should be available on the website today in the meetings section of our website. Thank you.
Thank you so much, Santiago. Do any of my colleagues have any questions or any members of the public? Okay, next we'll go to our next agenda item, which is the litigation report with Chief Board Counsel Todd Ratchin. Todd?
Hi, good morning. Thank you. As if on cue, I've got my neighbors firing up their leaf blowers and lawnmowers, so hopefully it's not, you can still hear me okay over everything. A few litigation updates to report since the December 8th meeting. I'll start with state court actions involving petitions challenging board decisions. We have Smith Packing versus ALRB in the 2nd District Court of Appeal. It's case number B308102. It's a challenge to the board's decision in 46 ALRB number 3. The employer filed its opening brief on January 14th, and the board's respondent's brief currently is due February 18th. Then in California Artichoke and Vegetable Corporation, Vegetable Growers Corporation, Ocean Mist Farms versus ALRB in the 6th District Court of Appeal. This is a new matter. It's case number H048797 involving a challenge to the board's decision in 46 ALRB number 5. The petition was filed on January 28th. And the board on February 3rd filed an application for an extension of time to file the certified record, which the court granted this morning. So the certified record now is due on March 10th. And the petitioner's opening brief will be due 35 days after the certified record is filed. And then finally, in the United States Supreme Court, Cedar Point Nursery versus Hasid, case number 20-107. Since the last meeting, the growers filed their opening brief on December 31st. There have been a number of organizations that filed amicus briefs within the week following the employer's opening brief. The board filed its opposition brief on the merits last Friday, February 5th. Amicus briefs in support of the board will be due on February 12th. The petitioner's reply brief will be due March 8th, and the court has scheduled this case for oral argument on March 22nd. And I understand that there will be more information forthcoming as we get closer to that date on how to listen in to the telephonic arguments.
Thank you, Todd. Do any of my colleagues have any questions? Any members of the public? Okay, going on to our next agenda item, number 6, the General Counsel's report. General Counsel Montgomery.
Thank you, Chair Hasid, and good morning, board members and everyone else who's present. So for my report, I am going to start by highlighting our outreach efforts. And I'm very pleased to report that we have our new outreach team fully in place. As I reported in prior board meetings, we were working very hard to interview, recruit, and hire a team of an outreach manager who'd be statewide for ALRB, as well as 2, we call them training and community education specialists, 1 for the Visalia region and 1 for the Salinas region. And we have hired all 3 positions. Daniela Ramirez, who you all met last month at our board meeting, she is our outreach manager and communications director. And so now we have Erica Flores, who is our outreach specialist in Visalia, and Jaylee Quiroz, who is the specialist for the Salinas region. And so the 3 of them have been hard at work coming up with work plan, communication plan. We have provided in the general counsel program, we've provided them with, and we're finishing it up this week. We're providing them with a new staff training to make sure they understand the full range of the ALRB's work and the issues that we handle, considerations to keep in mind when doing outreach and media communications. And so that is underway. And I'm just thrilled to see the level of commitment, dedication, and enthusiasm of this new staff. And it's a true pleasure and a huge opportunity, I think, for the ALRB to have 3 full-time funded staff members who are focusing exclusively on outreach and communications. And I think that's going to make a huge difference because we've been always involved in doing outreach in the regional offices. And of course, the regional office staff is working closely with our outreach staff, and they've been meeting, informing them of the local issues, introducing them to everyone in each region and community. But as our regional office staff is also charged with investigating unfair labor practices, filing complaints, preparing for hearings, holding elections when those happen, and all the other responsibilities they have, it is the amount of time they can devote to outreach really does go up and down depending on what the casework is. Whereas now that we have these 3 outreach specialists, I'm hoping that we can have a lot more continuity. We should be able to. And I know already they've been in communication and coordination with our partners at the Labor Workforce Development Agency and Department of Industrial Relations, who we're closely partnering on to get information out to the farm worker community. There's, of course, a whole effort of funding nonprofits, which I know we heard a little bit about earlier in this meeting, that those funding efforts and in coordination with nonprofits is ongoing with respect to just information, not just about vaccines, but about COVID and workplace safety as well. And so we're feeding into that. And we're going to be providing training and resources to those nonprofit organizations and their staff so that they are aware of who we are at the ALRB, what we do, what resources we can provide, so that we can have a better network of referrals. And of course, as I've mentioned in past board meetings, we continue to have our hotline, our 800 number, which we have made available statewide to farm workers, not just for ALRB issues, but for other issues that people need help with, relating to questions about COVID and employment benefits, sick leave, whatever it may be. We assign staff in each region every day. We have an attorney and a field examiner who's assigned as the officer of the day, and they staff the phone line and make sure that they're providing information and resources and referrals to folks who need help. And then we're engaging in follow-up as well to make sure that people get where they need to go and have what we call a warm handoff to our sister departments when, say, we're making a referral to the Labor Commissioner or to Cal OSHA. And we're having regular meetings as well with that staff to make sure that we're continuing to coordinate that so that people can get where they need to be and get the help they need without having to engage in a guessing game of who to call for what issue. And so we've distributed and with other state departments and nonprofits, tens of thousands of brochures and pamphlets that have information about COVID-19 related government, state government resources, as well as our 800 number. And so we're hoping that will continue to be a resource for folks and its usage will increase, which it has over time, but it's still, we're hoping that it is better utilized. And we're continuing to do that outreach. Our staff has also, our outreach staff has participated with some of the regional offices in 5 different food distribution events since our last board meeting. And also 5 appearances on radio and TV in both the Central Valley and Central Coast. I believe there was a Univision presentation in the Central Valley in Fresno, as well as a number of radio appearances. So we're continuing to provide that resource. We're also looking at we're working on getting a regular weekly radio broadcast out of the Central Coast that we're creating a curriculum for. And so there'll be more to come on that. And then our staff also participated in a community event in Coachella last month where they tabled and distributed information to farm workers together with other nonprofits in a socially distanced manner, of course, outdoors. And so as I understand, more of those events through Listos, through the Office of Emergency Services, will be planned and are being planned in various regions throughout California. Several of us, including board member Hasid and Flores and I, we attended such an event last fall that Listos organized in Mendota in the Central Valley. We're hoping that we can continue to have a presence. We plan to have a presence at these upcoming events and to continue to provide information to the community. Now, of course, we have to be very mindful of risk to our staff when interacting with farm worker communities. So we are continuing to provide masks and shields and everything for folks to try to keep them safe, and address concerns in that regard as well and try to keep people safe. So that does to some extent limit what we're able to do as compared to non-pandemic times, but we're making the best of what we have and what's available to continue to provide that in-person interaction with the farm worker community. And we also had a check distribution event, moving on, in Salinas in mid-January, where we distributed over $400,000 to 528 workers over 2 different days. And kudos to our staff. We had some staff members in Salinas, in the Salinas office, who organized this event and made sure that we had a very efficient system for getting people in and out, and also make socially distancing folks outdoors to ensure that we weren't increasing anyone's risk of getting COVID, neither the workers nor our staff. Our attorney, Michael Marsh, in the Salinas office, was kind enough to share, he had an extra store of N95 masks that he used for woodworking that he said he didn't need. So he made those available to our staff when, those have been in short supply. And there was just a lot of dedication and commitment of our general counsel staff to come together. Several people traveled from other offices to assist with the distribution so that we could process people more efficiently. We also had our outreach staff come and provide information and outreach to the workers as they were standing in line to get their checks. So I was there one of those 2 days and was just very pleased to see how the staff came together and just the level of dedication and commitment that people have in these times. We've also, as our executive secretary mentioned, we have had 2 post-complaint settlement agreements that we've reached since the last board meeting. One was with Terra Linda Dairy, which is a dairy in Tulare County, where a worker alleged he was disciplined and then fired for urging his co-workers to request work boots, which if you're not familiar with dairy work, it's very wet and dirty. There's a lot of urine and feces as well that the cows produce. And so it's critical that workers have rubber work boots to protect themselves as well as other gear while they're working. And apparently, it was alleged that this employer wasn't providing that gear to workers and requiring them to pay for their own gear. And so this worker alleged he was talking to folks about that, and it got found out. And additionally, he had raised concerns to management about the company's overtime policy. And he said he was disciplined and then fired thereafter in retaliation for that protected activity. And the general counsel, we investigated, found the allegations were substantiated, filed a complaint. And shortly before hearing, we settled with the company for $33,000 in back wages to make the worker whole for his lost wages and some front pay as well in the reinstatement. As well as the employer's agreement to not interfere with workers' rights under the Act, and of course, the standard reading, noticing, and mailing to workers. And then we also got an agreement to provide supervisor training to the employer's management staff. So we're hopeful that now that they are well trained and everyone is aware of their rights and obligations, that this workplace will be a better place going forward for workers. We also settled a case post-complaint involving satellite farms, which satellite farms grows raspberries. And there was a raspberry harvester in Santa Maria that alleged that the company terminated her when she spoke up on behalf of her coworkers about working conditions, which included concerns about one of the box punchers' inexperience and mistreatment of the crew. And we investigated, again, filed a complaint and entered into an agreement last month where Satellite agreed to not interfere with workers' rights, to pay the worker for her economic losses, which totaled $6,238. And then, of course, we'll be doing the reading, posting, and noticing to workers there. Additionally, we reached a pre-complaint settlement in one of our investigations involving Coast King on behalf of lettuce harvesters in Monterey County who alleged they were threatened with termination after complaining about working conditions, which included being required to work past their scheduled work time. And that they also alleged their foreman had failed to provide them drinking water during hot weather in further retaliation of their complaints. And we entered a settlement agreement with the employer last month where they agreed not to retaliate and not threaten or retaliate against workers. And we're conducting reading, noticing, posting to the crew during their peak season. So those are a few settlements we reached. And then finally, I'm just going to mention that we have several job opportunities in the general counsel program. I have vacancies for 2 attorneys, one in Salinas and one in Visalia, so for just regional office attorney vacancies, and these are all posted on our website, as well as an attorney 3 and a deputy general counsel, which is an attorney 4, that will be working directly with my office. So there's some job opportunities out there for attorneys. If you know anyone who is interested and you think would be a good fit and enjoy the challenging work at the ALRB and exciting work that we do, please direct them to our website, pass on the word. I would love to have this be broadly circulated and give folks an opportunity to apply. So, and with that, I'll just take any questions that you have.
Thank you. I don't think I have any questions. Appreciate all the work that your staff are doing, particularly in these challenging times. Their creativity and the way they've come together, particularly I think one of your attorneys who offered his own supply of N95s just to ensure the safety of his colleagues, really appreciated. So great work. Any other questions from my colleagues or members of the public? All right. Thank you so much, General Counsel. Next, I'll go on to item number 7, the Division of Administrative Services report for Brian.
Morning, Brian Doherty, Chief of the Administrative Services Division. Just have a couple of brief updates since our last board meeting in December. I did provide the board as part of the hearing an updated expenditure report that reflects all of our board expenditures through the month of December, which is the most recent reporting period. Just as kind of a high level summary, our budget is approximately $11.8 million. And through the month of December, we expended approximately $5.8 million, leaving a balance of about $6 million in reserves. So based on current projections, we are going to stay well within our appropriated authority for the fiscal year expenditures. As my colleagues have mentioned, we have several vacancies right now that are in various stages of recruitment. Currently, there's 7 vacancies across the entire organization. There's including one within the Administrative Services Division that's currently in the recruitment phase. In addition, on an IT front, the only other update I have is to notify everyone that we did receive notification from the Department of Military that we are scheduled for our annual assessment on our IT security assessment that occurs on a basically bi-yearly assessment. So this will be an opportunity for the Department of Military to come in and do both an assessment of our IT security standards that are in place, as well as penetration testing to ensure that we are following state protocols to ensure the safety of our IT infrastructure. So that engagement should happen sometime at either the end of April or early May. And then I'll have updates to provide on any remediations that we'll need to work on moving forward. So with that, I'm happy to answer any questions that anybody may have on the administrative front.
I don't have any questions. Just thank you, Brian, to you and your team for all of your hard work that you've been doing, especially as we've been working with some mandatory cuts to our operating expenses. Really appreciate the due diligence and that you and your team have done to get us to where we need to be. So thank you. Any other questions? Okay, next I'll go on to agenda item number 8, the regulations report. First, I'll ask from Chief Board Counsel Todd Ratch, and then I'll see if there's any updates from our subcommittee. So Todd?
No regulatory action updates that I have to report.
Okay. And then any other updates from our subcommittee? Okay, all right. Moving on to the next agenda item, number 9, the legislative report. Todd?
There currently is no legislative bills pending regarding our act, so nothing to report on that front.
Okay. Moving on to agenda item number 10, the personnel report. The board has no personnel items to report, so I will now move on to agenda item number 11, general public comment. Santiago, do we have any members of the public wishing to comment in the queue?
No, no one's in the queue.
Okay, great. All right. Going on, our last agenda item number 12 is announcements. Please note there's a regional directors meeting today at 2. That is a separate, there's a separate agenda for that with separate dial-in information that can be found on our website. I'd like to reiterate that the Cedar Point oral arguments have been scheduled for March 22nd, with more information forthcoming about how you may listen to those oral arguments. Our next public board meeting is Tuesday, April 13th. And I'll note that our entire 2021 schedule for the public board meetings and the regional directors meetings is up on our website right now. I'd also like just to comment on some of the comings and goings. Thank you to Sharon Massey for coming back to our team to help train some of our new staff. She's a long-serving staff member at the ALRB with a wealth of institutional knowledge, and we're grateful for her briefly stepping out of retirement to assist us with training our new staff members. I'd also like to say congratulations, and we will miss you, to Deputy General Counsel Silas Shaver, who will unfortunately be leaving us this week. He's done a lot of great work, and we're so grateful for all of the work he's given to the board and the staff. And with that, this meeting is now adjourned and the record is closed. Thank you so much.